Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Age of 85.
What is the brain cancer?
Brain cancer is an overgrowth of cells in your brain that forms masses called tumors. Cancerous, or malignant, brain tumors can grow very quickly, depending on the type of tumor. They can disrupt the way your body works, and this can be life-threatening. Causes and risk factors for brain cancer. The exact cause of brain cancer is unknown. However, factors that can increase your risk of brain cancer include exposure to high doses of ionizing radiation and a family history of brain cancer. Cancer in another part of your body is also a risk factor for developing a tumor in the brain, though these aren't called brain cancer. They are cancers that have spread to the brain. Cancers that commonly spread, or metastasize, to the brain include lung cancer, breast cancer, kidney cancer, bladder cancer, melanoma, which is a type of skin cancer. Other factors that might be related to developing brain cancer include increased age, long-term smoking, exposure to pesticides, herbicides, and fertilizer, working with elements that can cause cancer, such as lead, plastic, rubber, petroleum, and some textiles having an Epstein-Barr virus infection. Headaches that are usually worse in the morning, nausea, vomiting, a lack of coordination, a lack of balance, difficulty walking, memory lapses, difficulty thinking, speech problems, vision problems, personality changes, abnormal eye movements, muscle jerking, muscle twitching, unexplained passing out, or syncope, drowsiness, numbness or tingling in the arms or legs, seizures. Many of the symptoms of brain cancer are also caused by other, less serious conditions. There's no need to panic if you're experiencing these symptoms, but it's a good idea to visit your doctor to have your symptoms investigated, just in case. How is brain cancer diagnosed? If you have symptoms of a brain tumor, your doctor may perform one of the following to make a diagnosis: a neurological examination to determine if a tumor is affecting your brain, imaging tests, such as CT, MRI, and positron emission tomography, PET, scans, to locate the tumor, a lumbar puncture, which is a procedure that collects a small sample of the fluid that surrounds your brain and spinal cord, to check for cancer cells, a brain biopsy, which is a surgical procedure in which a small amount of the tumor is removed for diagnostic testing and to determine if your tumor is malignant.
Glioblastoma multiforme is a destructive and fast-growing brain cancer. It develops from glial cells in the brain and is the most common cancerous brain tumour in adults. Day-to-day monitoring of patients relies on the two-dimensional imaging technique known as magnetic resonance imaging, or MRI. Images of the patient's brain are taken whilst they lay in an MRI scanner. Healthcare professionals can then use the images to monitor the most active region of the tumour, known as the area of contrast enhancement, and also to educate the patient. But these 2D images don't provide a detailed view of the tumour. They make it difficult for the clinician to know whether the disease is stable or advancing, or whether the patient needs a change in treatment. Dr. Darren Akuda and his team at the UT Southwestern Medical Center in Dallas have designed software that can isolate and edit in 3D. This allows clinicians to study the shape, structure, and surface features of the area of contrast enhancement, looking at the tumour in a new way for the first time. The team used 3 different measurements to reveal more details of the tumour. Principal component analysis was used to uncover the shape of the active region. The thickness of the contrast-enhanced shell was studied using medial axis transformation. Coverage analysis was used to determine the surface texture. This 3D technology allows a greater understanding of the complexity of the tumour's area of contrast enhancement. This may allow healthcare providers to better recognise tumour advancement. This technology is not only useful for brain tumours, but will be of value in other medical specialties, allowing healthcare professionals to provide optimal care for their patients.